Hey, Margie here. Today we're talking about something that's often overlooked in the traditional medical community, and it's so important and powerful. It's the role of stored trauma and emotions in our bodies. And I'm really excited because I love today's guest, Dr. Aimie Apigian. And Dr. Aimie is a board certified preventive and addiction medicine physician with a double master's in biochemistry and public health. She specializes in trauma, attachment, and identifying and reversing the effects of stored emotions in the body and on our health. Having personal experience in foster parenting, adopting, and then having her own chronic fatigue and autoimmune issues, she has discovered that negative life experiences become our biology, not just our psychology. And it can compromise every system in our biology. And these stored emotions can cause inflammation, digestive issues, and contribute to all types of disease and aging. Stored emotions become the biggest thief to our health, happiness, and aliveness without us even knowing it. A two-time summit host, she's the founder and director of Family Challenge Camps, a week intensive for families, and the founder and CEO of Trauma Healing Accelerated, where she provides education and courses for those wanting to hack their survival systems and accelerate their healing journey from trauma to achieve their best mental and physical health. Her courses include experiential courses for the general public on shifting the biology of trauma and certification coach for those who are in a healing profession to really give them more tools for understanding and addressing the biology of trauma. And in today's talk, we really delve into this topic. And the interesting part, it's not a huge trauma that we think about. It could be minor traumas or that we think of minor, but they can impact our entire life. And the best part, my favorite part of this interview is near the end when Dr. Aimie takes us through two little exercises that are great. I know I felt so good at the end of this, after doing those exercises. So if you're ready to relax and feel amazing, then definitely listen and stay till the end. Welcome, Dr. Aimie. I am beyond thrilled to have you here. Last time it was in December that we did a program together, and I had so much fun, and I got so much feedback how what you taught just helped so many people. And this topic is absolutely paramount. And what's interesting, a lot of people have no clue that this could be impacting their life and their condition. And when they address this piece, everything else falls in place. So welcome, welcome.
Thank you, Margie. It's always good to see you. I love the work that you're doing, and it's such an honor to be here.
Well, let's start. I always like to hear the backstory before we get into everything else. The meat. How did you get into, here you're a physician and you're board, you have a lot of credentials, but how did you really get into dealing with trauma and figuring out this piece of it?
Well, I mean, our story is hard to know exactly where it starts, right? Because now looking back, it's like, well, it actually started before then. Well, actually, now that I'm seeing the bigger picture, it actually started before then. So I would say that I'm one that has also this kind of generational trauma, right? Like my grandparents went through a genocide and survived and had to crawl out on their bellies and then be able to save themselves from a massacre that was happening the next morning. So that's kind of like the history that I stand on their shoulders. And then I adopted my son from the foster care system. This was when I was in medical school at Loma Linda University. And I was also getting a master's in biochemistry at the time. And so very, very heavy into the science, Margie. Like I am one of those people who was always found with a book. Loved reading, loved learning. And so when I had a little space in my life, I thought, hey, this is something that would be really meaningful. I, of course, know everything to do. I know just what these kids need. And so they placed a 4-year-old boy with me, Miguel. And then 9 months later, I was adopting him as a single mom. And everything that I thought that he would need and respond to did not work. And he had had, of course, a very, very traumatic early childhood, just by the fact that he was in foster care. We know that, right? A lot of disruption, and not only disruption, but there had been abuse and neglect and all of that, all of that, all of that. But I was convinced, Margie, that I was so smart, that I was so special. I don't know what I don't know, but I just knew that he was going to respond to my love, that all I needed to do was love him, and he would be happy, he would be healthy, he would love me in return. And that is not what happened. That is not what happened. And he was on a very difficult journey. And this is kind of where I started to learn that these life experiences for him were not something that he was just going to be able to, oh, just change your thinking, just choose happy thoughts, reframe your childhood. Aren't you so lucky now? Right. And it's like all of these things that many people still, like, we tell ourselves that, right? Like we tell ourselves that that's all you need to do. And it's just not true, because trauma is stored in the body. It actually changes how we are wired. It changes our program. So it's like we have a computer program that's always running in the background, and it changes how that program runs. It changes our safety and alarm system. And so we can be in a completely different environment. We can be, 30 years later, 3 decades later, and still be having the same insecurities that we had as an early child, because that stuff gets stored in the body. And like you say, many people don't recognize this, right? And yet it really has become the true root cause of many physical, mental, and emotional health conditions. And until we bring this piece in, we're just going to be held back, right? It's not the only piece, but it certainly is a piece that will make things worse, will make things harder, will make our symptoms worse, will make our journey longer if we are not addressing this nervous system, this program that's running behind the scenes. So I had my own health crash and got to learn this also personally. So not only through my son, but then through my own health crash. And my own health crash really showed me like what is needed to reverse things as an adult. Because when we're working with a kid, I was able to, figure out all the pieces. It took me a long time, figure out all the pieces, but kids are relatively easier still to adapt and to change their nervous system, right? But for us adults, we've been programmed to live this way, to have these certain coping mechanisms for a long time. And by the time we start having health conditions like I developed severe chronic fatigue, some autoimmune markers were high. And then I also had mold, and I had all these other stuff. And it was just realizing that by the time we get to that place where we're having physical health conditions, it's not just a simple fix. It's not just, go to therapy and you'll be fine. Like, there's actually a biology of trauma that's been playing out, and we've got to address all of that. A lot of the work that you do with the osteoporosis, right? Like that inflammation and those imbalances can all be as a result of this chronic stored trauma that just under the surface is creating problems without us being aware.
Wow. And it's so interesting because you've helped so many people with your work.
Yeah.
And so let's dig deeper, because where do you find most people the trauma comes from? Like, where does it start for most people?
Well, yeah, that's a great question. And when I tell people this, they don't always like it, Margie, but I'm going to say it.
No, go. We're open here. We want what works. I think that's what's
right?
What I love about the podcast is we want to hear what really works. And even if we have to, and we're looking for root causes, and we're looking for our best health. So we're open. So hit us with it, Dr. Aimie. We're ready.
All right. Here we go. So most of it comes from childhood. And this is what I discovered when I went through my health crash, was that everything that I was experiencing, I knew from my work with my son and my medical studies that it was associated with early childhood stress. Your audience may know about the adverse childhood experiences study. They may not. What that is, it actually started as a result of a preventive medicine doctor in the Kaiser system who started to recognize that all of these women with obesity coming in for that, bariatric extreme weight loss surgery, because nothing else was working, many of them had a much higher percentage of sexual abuse in their past than the general public. And that just piqued his curiosity. And so he started digging deeper and found that, oh, it's not just sexual abuse, it's all this other stuff as well. And so when I went through my health crash and I'm looking at my health conditions and symptoms, and I'm like, why Margie? Like, why me? Like, this was not my past. This was not my childhood. There was nothing that I went through that is nearly compared to what my son went through. If this were my son, absolutely, I would totally understand it, right? And I would almost kind of be like, well, this is to be expected. There's nothing we can do about it. And so, but this is happening to me. And so it really opened my eyes and started me down that path of understanding, wait a second, why would I have these physical health symptoms and conditions that are associated with early childhood stress? And that's where I discovered this whole attachment piece, Margie. And so when we look at attachment, many people can look at whether they have an attachment style. What is their attachment style? Do they have an insecure attachment style? Do they have a secure attachment style? And this is where the statistics really helps us understand why most of this truly originates in early childhood, because the studies show that over 80%, and I would say it's closer to 90% of people now, have an insecure attachment style coming out of early childhood.
So can you just explain that a little bit, what that means?
Yeah. Yeah. So an insecure attachment style is going to be where you generally feel unsafe in the world. You have just this general feeling in your body that the world is not necessarily safe, that people are not necessarily trustworthy, that you've got to kind of watch yourself, be on guard, watch who you are open and honest with, because people just cannot be trusted. The world is generally not safe. So, and for people who want to dig deeper into that, I have some videos on YouTube that talk about the different fears and insecurities and thoughts of a person with insecure attachment. So that is what we develop coming out of childhood, is this basic, again, I kind of started the conversation talking about this background computer program that runs our body. And if that program is programmed to see the world as generally unsafe, that's going to be a very different biology that plays out than if it feels generally safe. And I do have support, and I do have these people in my life that are amazing resources, and I can be completely myself with them and share all of even the bad things about me, and they will still openly love me and accept me and support me. And most of us came out of childhood with a very different experience. Perhaps we felt like we couldn't really be our true self, that maybe we were too much, or maybe that we were too little, or not good enough, or there's so many different dynamics that happen in our families that create this sense of I don't know if I'm going to be okay. And I'm always looking for, how can I be okay? What do I need? What do I need in order to be safe, rather than just already naturally feeling safe?
Wow.
And so,
Right? I think the interesting thing, though, is that, you hear about trauma and you think of a major trauma, like you said, like your son went through, you think of something catastrophic that happened. But here you're talking about things that really could be every single one. There's so many people that can be saying, oh, yes, that's me. I don't feel it's a fair universe, or I don't feel the universe is on my side. Yeah.
Yeah. And if you have any doubt about whether, how your internal program is running, think of your relationship patterns. Think of the specific challenges that you've had in relationships, or the patterns that you've had in relationships. What kind of people do you seek out? What are the types of things that happen in your friendships or in your romantic relationships, or even at work with coworkers, with a boss? These are where insecurities really can show up if we know how to look for them. And so it doesn't need to be a big major trauma, a big major event. And this is what we get to understand is trauma, Margie, because it really helps us define, okay, then what is trauma? If that is what kind of starts all of this, what is the definition of trauma? And the definition of trauma is anything that overwhelms our system. That's it. That's it. So there's the difference between stress and trauma. A stress is something that we go through, but we're able to accomplish, we're able to get through it. We're able to then come back to our baseline state of health. It's something where whatever it is, whether it's a good stress, like, hey, we're going to go, run a 5K, or if it's a negative stress, like, oh, there's this new deadline and I need to put all of my attention on this and hyper focus on this. Whatever the stress is, that's it. Like we are able to meet the challenge and then come back to our prior state of health. A trauma is when we're not able to meet that challenge. We're presented with a challenge, we're presented with an obstacle, we're presented with anything, and we're not able to meet that. And in fact, we go into this overwhelm. And there's all this kind of stuff that happens in that overwhelm state, including all the shame and, those thoughts, the exhaustion, the fatigue. But when we think of a young child, when we think of a very young child, in fact, and we think of the family dynamics that they were in, that they were surrounded by, if a young child does not feel that they can truly just be themselves, that by itself is going to overwhelm their system.
Wow.
And so we really get to redefine then what trauma is and when does it really start? When does it start to seed our internal programming and start to move us in that direction of feeling more insecure, having more inflammation, having more imbalances in our hormones, having some digestive issues that then feed off onto that. And when we trace it back, like this is often where we see these patterns starting was, did you feel completely safe as a child? Or were you one who kind of had to watch your parents' moods and what mood are they in right now? Because that determines how I'm going to be right now. That right there is overwhelming for a young child. As an adult, we could probably navigate something like that and it wouldn't be overwhelming. But for a young child, we need to think about, how young was I when I went through this? What were the resources that I had? Did I feel supported? Did I feel resourced? Did I feel completely contained and safe and held and all of that? And if not, the answer is, well, then that would have been overwhelming for your system and started these trauma patterns being wired into your nervous system.
Wow. So it could really be stored anywhere in the body, and it can be stored for your whole life, is what you're saying.
Exactly.
Early childhood, you may not even be aware of. And then what typically happens, I'm big into root causes. So yes, you're addressing digestion, and yes, you're working on hormone balances and everything else. But yet there's a deeper piece. Like as we peel the onions off, there's this deeper piece that to truly heal and be on your journey, the best you really need to address that. And the good news is that you can. That's what's, do we want to go to that? Are we ready to go there on how people, what do they do? Like, what have you found successful? Because this is what you've been doing and you've had such amazing results.
Yeah, this is something that has become truly so meaningful for me, right? And this was a very different path. I was actually headed towards a general surgery practice and left that because I really enjoyed this trauma work more than anything else. So let's jump to solutions. What can we do? And when we think of what this is like, how trauma in the body and true root cause, I like to think of it as even like a pond. So here we have a pond. This is our body, and it's gotten dirty, Margie. It's got algae growing in it. It hasn't been cleaned out in a while, and we need to clean it all out because it's collected. And so we start addressing all of these pieces, right? Whether it's be the inflammation and the gut issues, whatever it is, we start cleaning it out, but it just keeps filling back up. And it's not until we go upstream and find, oh, there's this little creek or there's this little source underneath this rock that keeps fueling this pond. Oh, until we really address that, we're always going to be having these issues that we're trying to manage, but not really getting to that true root cause. So how do we address that stream? How do we address that program that's constantly running underneath the surface, creating these problems and now maintaining us in this insecurity, inflammatory state? And this is where we get to work with the nervous system. And we need to rewire the nervous system, Margie. So if the nervous system is wired for insecurity, we need to rewire it for safety and security. And how we do that is also twofold. So we do that by addressing the biology. We've got to address the actual, even down to an individual nerve cell and what is it going through that it is being stuck in survival mode or even stress mode. And then actually, how do we rewire so that these insecurities, these triggers are no longer triggering us into these overwhelmed and insecure places. So with the biology, I'll just briefly mention that because I know that we really want to focus on some of this other somatic type of work and how do we actually work with the nervous system directly. With the biology, sometimes what has happened is that there's inflammation around the nervous system. We can have neuroinflammation, we can have inflammation in the gut. All of this is going to keep the nervous system in a state of danger. There's nothing like inflammation to signal danger to the nervous system. So now we're at the place where it doesn't even have to be an external danger. It can be internal. And inflammation is an internal signal for danger. And so if we're really serious about rewiring our nervous system, we need to be addressing the inflammation. Now, the trauma is going to feed into the inflammation. So we also need to deal with that. And it just has become this vicious cycle that feeds off of each other. The other biology piece that's really important for the nervous system is the energy. And, when you think back on just the laws of physics, the laws of physics tell us that if something is moving in a direction, like a train, if a train is moving down a direction, you have to apply force. You have to apply an energy to make it go in a different direction than what it is already going. So same thing here. We've got our nervous system and it is going in this direction. This is how it's always done things. And if we want to change that and change how it is wired, we need to bring energy. We need to have energy. So for many people, they do have a mitochondrial compromise. They're not making energy as well. We need to also improve their energy production in this process to have the energy to change this wiring of the nervous system. So that would be my two really, really most important biology factors when it comes to rewiring the nervous system. So how do you actually rewire the nervous system? This is where I have tried a lot of different therapies, both for my son and for myself, and I've come down to what I have found are the most effective. Thankfully, they're also very simple.
Yeah, that's what I love about, I know you're going to take us through a somatic experience because
Yes.
what you did was so powerful and so simple that really left all of us almost in the state of wow, this is incredible. So keep on going because this is everyone listening. This stuff really, really works and it's not difficult. Just what I like easy things that are powerful. Not that this whole process is completely easy, but you have some amazing tools that everybody can put into use. So keep going.
Absolutely. Yeah. And this has been for me what has really changed both my personal life and my professional life is wait a second, this trauma stuff doesn't need to be as complicated and hard as we have generally made it out to be. It really is quite simple and easy. And we just need the right eyesight to see what needs to happen and then the tools. And so what I've done with my work is especially over this last year, I have made it really my focus to give people tools and skills that they can do on their own. I don't want them to have to go see a therapist that they only see for once a week anyway, because then for the whole rest of the time, they're still stuck in their overwhelm and their trauma patterns and their inflammation and insecurities. And it's like, no, 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 no. If we're going to rewire the nervous system, it's like a tree. And where do you live, Margie?
I live in Morristown, New Jersey.
Oh my goodness. All right. So when you're over by the ocean, you can see that trees or shrubs will grow in a way that they've adapted to the wind coming off of the ocean. And so the nervous system is like that. The nervous system has merely adapted to our life experiences. It's not that it's bad. It's just that it's adapted, right? So here you have a tree and it's growing sideways now instead of upright. We want to get that tree growing upright, Margie. So how do we do that? Well, we could go over to that tree and just bend it and be like, nope, you're going to grow up, and we bend it. And what happens is if we just go over it and bend it, it's going to snap. It's going to break. What we need to do instead is actually provide all of this support, put up some posts, put up some wires so that it gently, as it grows, it is now growing towards the direction in which it will be the healthiest. That's what we do with the nervous system. So when we do this somatic work, we don't start with anything big and huge, because our nervous system would break. Like, it would put us back into overwhelm. So we just start with gentle stuff, but it does need to be consistent. It's not like we can come over to the tree once a week and be like, no, 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 I really wanted you to grow this way. Once a week is not going to be enough. This is something that we need to be doing on a daily basis. And with that gentle consistency, we're going to be able to rewire our nervous system for feeling safe and secure in the world. So I would love to share a few short exercises with you guys, with your audience, so that you know, like, this is where you can start. This is not going to be the end, right? There's just so much more. And you can, I have some courses on my website that you can take. I have both a completely do-it-yourself Shift to Calm Aliveness course, but also a 21-day journey where we're meeting every day to help you rewire your nervous system. So these exercises are not gonna be the end all, but it is going to be a great place for you to start. So Margie, would you say that people in your audience deal more with overwhelm or sadness?
Overwhelm, definitely. Overwhelm audience. Yep. I mean, to me, overwhelm, it's funny in my happiness course. I always, and because, when we're giving people things to do, you certainly don't want to get overwhelmed by trying to do gratitude, or, so I think overwhelm's the enemy. We totally,
Yes.
This is big,
yes.
And that's what people tell me. So this is a big overwhelm crew. So continue. Yeah.
Right. Overwhelm. And yes, overwhelm, when you feel overwhelmed, that's actually a trauma pattern. So that is one way that you know that you have this pull towards what I call a chronic functional freeze state. And so we're going to work with overwhelm and this tendency for your body to kind of shut down, collapse, want to hide, want to go back into bed, pull the covers over your head. And that is the overwhelm. So Margie was actually already starting to do it. I noticed that she had some movements that we're going to go back to, and these are natural movements. So when we think of the nervous system, how do we work directly with the nervous system? The nervous system controls our muscles, right? It not only controls our heart and our breathing and our digestive system, but the nervous system controls our muscles. So that's how we can actually directly work with our nervous system to create a sense of safety. So Margie, right now, I know that this is not you at all, but if you could give me a number for overwhelm right now, where would you be at?
Right now?
Yeah,
where 10's the worst. And
yeah,
I would say maybe a 3.
A 3. Okay, awesome. So let's do this. Let's bring our hands up and face the palms outward. Bring them as close to your shoulders and your neck as you can. And what we're going to do, Margie, is we're going to start pushing away. But I want you to imagine that what you're pushing away is a huge boulder that is even bigger than you. In fact, if you want to kind of reach your hands up and be like, yeah, this is how big the boulder is. Wow, it's huge. It's heavy. And what we're going to do is we're going to try to move this boulder. Are you going to be able to do it fast?
No.
No. So that's how slow I want you to go. And if you've got your feet firmly on the ground, that will help because you can actually push your feet into the ground to help you. I've got a hard back behind my chair, which again is a somatic trick that I use for my body. But and we can go into that later. But if you can push your back into something, push your feet into the ground as you are pushing with your hands, that will give you the best results. All right, so let's start pushing. And again, this is a huge boulder. So you're having to go really, really slow and all of your muscles are engaged. And you can decide exactly what angle you want to try to push it at to make it move. Get it to just budge a little bit. So your muscles, your biceps, your triceps should be fully engaged here. And you're pushing. I'm even pushing into the floor, pushing into my back to push this heavy, heavy rock away. And when you get to the very end, you can kind of pause there. The very end means that, yes, your arms are fully extended and you can just pause there. Oh, and there's a deep, spontaneous breath for me. And then you can drop your arms in your lap. And
Wow.
now we just give it a second, Margie. We just give it a second. I'm noticing some stuff in my body just with that exercise. What are you noticing?
Well, I'm a physical therapist, so I love this because you're stabilizing your core. Just pressing your feet into the ground elevates your spine and opens it up. So it's amazing for posture. Yes. And it's an isometric contraction. So from so many levels, plus it let it out. I just feel so loosey-goosey relaxed.
Yeah, exactly. Yeah.
It's great.
I feel like this openness in my chest. I feel my chest is more open. There's more space. There's just some expansion in my chest. My shoulders feel like they're back more, but they also feel like they're down. They feel they're more relaxed. I didn't even realize that they were tight before, but they feel more relaxed. So that's cool. There's a softening in my belly. My belly, again, didn't realize that it was feeling tight, but my belly feels softer. And for me, I had that deep spontaneous breath, which a deep spontaneous breath or a yawn is an indicator that your system has moved more towards parasympathetic. So right now, if we check back in with your number, we started at a 3 for you. What would it be now?
Yeah, I'm not even thinking of anything I have to do. I feel so good. I would say literally a 1. I just feel in this really great state, bring it on.
Yeah, exactly. So this is a great exercise specifically for overwhelm.
Love it. And posture, everybody. Do this throughout your work day. It will really help you. Really help a lot. I love it.
Exactly. And Margie, I'm so glad you brought that up because there is a trauma posture. And the trauma posture is one where you're bending over, your head is down. It's also called kind of like the shame posture, right? And so when you do these exercises and you create that space, you feel that your posture naturally improves. And so this is where you can focus on your posture, you can correct your posture, but also if you're feeling overwhelmed, it's going to be hard just to correct your posture. You're going to want to engage your nervous system, do an exercise like this, and then your posture will naturally be better for you.
Love it.
Yes. So let's do one more if you're okay with that.
Oh yes. These are so good on so many levels and they're not hard. That's what
they're not hard. Yeah. They're not hard at all. All right. So I'm trying to decide between the foot exercise or the VU exercise. Which one would you like, Margie?
The foot or what's the other one?
VU.
I don't even know. I don't know either one of them. So you pick whatever you're feeling. I don't know. For people with osteoporosis or people that are concerned about their bones, is there one? They sound like they're both amazing.
Oh, they are both amazing. They're both amazing. All right. Well, let's start. Let's do the VU exercise. This is gonna sound strange. This is gonna be weird, and we're just gonna be okay with it, right?
Oh yeah, people who are listening, we've had people on Talking to Angels. No, nothing is weird. We are open. This is an open crew. So you are in the right place, Dr. Amy. So VU it is.
Awesome.
Let's go.
Awesome. All right. So the VU exercise, and it's spelled VOO. The VU exercise is bringing life and flexibility into the vagus nerve specifically. So the vagus nerve, it comes out of your brainstem, it runs in your neck, it goes behind your esophagus, and it then goes down into your stomach where it branches out to all of your intestines and down deep into your pelvis. The vagus nerve is specifically where overwhelm gets stored. And so any person who notices that they can tend to go to overwhelm place, we want to work with the vagus nerve and just get it unfrozen a bit, get it a little more life into it, a little more flexibility so that it has a little more stress resilience. All right. So what we're going to do is the VU exercise is intended to vibrate that vagus nerve. And we vibrate it through a noise that will vibrate our windpipe. And since the vagus nerve is right there, it's going to vibrate the vagus nerve. So it's nothing fancy, very simple. I would recommend that people do this about 3 times a day, just for maintenance. If they're feeling overwhelmed, this is a great one to do as well. I actually pair them up together. So after I do a push away, I then will do a VU. So people can incorporate this however they want, but let's just do it. How's that, Margie?
Yes, let's go.
So what I want people to do is take your hands and put them on your belly. And this is where the sound is going to come from. The sound is not going to come from your chest or your throat. The sound is going to come from your belly. So when you put your hands there, it just kind of helps you focus on where that sound is coming from. And so what we want to do is we're going to take a deep breath in, and then we're just going to make that noise, VU, and we're going to say it all the way until our breath finishes. So we're going to be pushing all of the air out until we have no more breath saying this noise. All right. So hands on belly, deep breath in, VU. And then again, just like the other one, we just let it sit. This is kind of the key with the nervous system. Is after we do something, we just let things settle. We pause, and the magic happens in the pause. And again, like I'm feeling very much of the same things that I felt after the push away. My shoulders are feeling heavier, but in a good way. Like I really feel myself here. I feel the weight. I feel gravity pulling me down into my chair. I feel my feet more. I feel very much present and here, grounded. I feel very calm.
That's funny. I was going to say that word. I feel really grounded and tingly, which is
Tingly,
great.
yes.
Yeah, I feel like
Yes.
this great energy flow throughout. Which both my hands feel this really wonderful energy. I mean, that took like
tingling,
1 second. Yeah.
Tingling is amazing. So tingling is a sign that you have discharged some energy, some stored energy, some stored trauma from your vagus nerve. So good for you. That's awesome.
Yeah. So that was so short. So you're recommending 3 times a day? Can you overdo it? Can you overdo these things?
It's hard to overdo it. I have had one person who has done several VUs, and he got so tired that he had to take a nap, or maybe he just felt that calm that he took a nap, right? And so it's not something that I would worry about. Oh my goodness, like stop there. But again, we also want to do this gentle. So we want to ease into things. Right. And so 3 times a day is a great place to start. And if you want to do it 2 times, 2 VUs each time, that would be perfectly safe. And again, you're not doing this with the goal of, hey, I want this to happen. It's just, I want to do something good for my body. I don't know what will happen. I don't know what will come up. I may get tingling. I may get a deep breath. Nothing may happen. That's not the point. The point is just doing some really healthy maintenance work for our nervous system.
Oh, fabulous. So we could talk forever, but I'm really excited because you are having such an amazing summit coming up and such an opportunity for people to learn so
Yes.
much. I'm personally going because the topics are just incredible.
Yeah.
And so why don't you tell us about this, because it's the biology of trauma. Just tell us what this incorporates. It's free, it's open to everyone. So fill us in.
Yeah. So I have interviewed over 40 people, 40 experts on all things related to this biology of trauma and how to effectively rewire the nervous system so that a person at any age, with any health condition, with any mental or emotional health symptoms, can experience a better tomorrow by having tools to rewire their nervous system and get it back to a place, or maybe they never were in a place of safety and security, but being able to rewire that in now. And so this addresses all of these aspects that we've been talking about, the biology pieces. How does actually trauma get stored in the body? What is that? What are you talking about? What is this somatic work? How do you work directly with the nervous system? And, what's this energy piece, and what's this inflammation piece? And is this maybe why my nervous system is stuck in survival mode? So all of these pieces that were super important for myself, for the people that I've worked with, this was something that's like, all right, I'm ready to take this now and share this with more people. I want more people to have these tools. I want more people to just be aware that this can be affecting their health and that they can do something about it. I don't want them to feel like their past is keeping them held back or held down. No, 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 no. There is so much that we can do, and there's so much that we can even do on our own, because our bodies have so much innate wisdom. We just need to learn how to work with it and provided these tools to rewire the nervous system and where this trauma has been stored. So it starts July 19, goes through July 25. I know, and it's going to be huge. It's about 60,000 people who are registered. This is a topic that people are ready for. I think that people are done with the superficial stuff and the band-aids. Like they really want to help understand what's going on in their body and what they can do. So July 19 through 25, Biology of Trauma Summit. I'm actually going live every day as well to give people the highlights of what they should pay attention to in each of the interviews, because I want this to be a transformational experience for them. I want them to walk away not just with information, but actually with practical tools for what they can start implementing today.
Oh, so the thing is that when the podcast comes out, everybody, you get, what is it, 24 hours they can listen to the, so don't worry if it already started yesterday, you'll still have access, and you'll have access to, there's just so much. But the other really amazing thing is when they sign up, you have like great gifts and ebooks. You want to just tell about a few of those, because those in themselves are pretty amazing.
Yes, even just for that, I would register for the summit. Yes, there are some amazing e-guides from many of the speakers. There's ones that I have written specifically on, again, this how to rewire your nervous system. What are the important pieces? What are the important biology pieces? What's the somatic work? So I have those e-guides. And then I also have an e-guide on attachment. And so if this is something that kind of felt like you landed on that, it resonated with you of, I didn't feel completely safe and secure as a child. Okay, then let's talk about attachment and help you understand that better so that we have a better understanding of where it all started for you and what we need to do in order to help rewire that. So have e-guides on rewiring trauma as well as this attachment trauma.
Oh, this is great. And I just, before we end, just tell people what's possible, because they're listening to this, but what have you seen? You actually have experience that once you've helped people, what's the end product? What have you seen at the end of all this?
Well, and that's where it just has been so amazing, because people go from being sick, they go from being stuck in their health patterns, they go from being stuck in their relationship patterns, stuck in their thoughts, stuck in their stories. And all of a sudden, and it's not all of a sudden, right? Like this is work, this is a process, but then they get to this place where they're free of all of that. It's not that they forget their past, and we never even need to go into the story. We just go into the body, right? And now it's like they're standing on top of their history rather than it being on top of them and weighing them down. And so they're able to really have a much better health. Some people have been able to fully reverse their health conditions. Some people still have flare-ups, but are able to manage it better. And they know what their triggers are. They know their system better. So it allows this amazing increased capacity for their life, because now all of a sudden they're not just thinking of, okay, what do I need to get through the day? What do I need to do in order to manage my symptoms? I can't do that because that'll make me sick, or I can't do that because I don't have the energy, because I ache, because whatever. And now it's like, what do I want to do? I don't know. What do I want to do today? What do I want to do with the rest of my life? It just kind of like this exercise, right? Like it pushes away the overwhelm and it provides this space and expansion for growth and creativity. And that's really bringing back the wisdom of the body and what it is really intended to do.
Ah, well, on that note, and that's what we all want. That's what we all want.
Yeah.
And I guess what I want everyone to hear from you is it's possible. It's
Yes.
possible. And this work
Yes.
is so powerful. And that's what I've seen over my career as well, as physical therapist, et cetera, that when we address deeper things and our emotional state and all that, we can't just push it out the window. We need to.
Right.
So you have so many amazing tools, and I'm just really excited about this summit. So I'll have all that in the show notes and the links, and I'll also have the link if for some reason someone's listening to this and the summit is over, to your information, so they can also have access to your courses.
Absolutely. Yes.
And everything else.
Yes.
Is there any last minute things before we end? That was a great way to end, on feeling so empowered, but is there anything else you want to share with everybody?
Yeah, I mean, my encouragement would just be, don't feel like you have to go talk to a therapist. Don't feel like you have to go into the story, right? Like there can be so much negativity there. There can be so much heaviness there. And we now have these tools, and we realize that the body doesn't need that. The body just needs to process and release. And again, kind of like with the tingling, right? Like release some stored energy. And so it does not need to be as scary of a process, like, oh, I've got to go deal with my childhood trauma now. No, no, no. Like we're just working with rewiring your body to feel more safe and secure in the world, so that you can be at your healthiest. It really is as simple as that.
Well, thank you so much. It's always such a pleasure. I love your energy. I feel great. My day is going to be amazing today. The rest of the day. Yeah, no, these were great. So thank you so much for sharing all this. And I'm really, really excited for your summit. So thank you so much, Dr. Aimie, for being with all of us.
Thank you, Margie.
Wow, I loved this interview with Dr. Aimie, and I am feeling so good from the 2 exercises that we did together. If you didn't get a chance to do it, make sure to listen again and do them, because they're so powerful and easy to put into your life. All the links that Dr. Aimie talked about will be in the show notes. And do not miss this summit, the biology of trauma. She has so many great experts, and this is such an important piece of the equation. When we're trying to improve our bones, our overall health, we need to delve in. And the good news is there's so much that can be done. And Dr. Aimie talked about how she's seen such great results, and I have it as well. So I'll also have the links to her program, and bye for now. And I look forward to seeing you on the next episode.